For the next question, we'll look at what is known as a fibrous cortical defect and non-ossifying fibroma. Okay, fibrous cortical defect and non-ossifying fibroma. So it's just like we're discussing two conditions in one video. Okay, so let's do justice to this. Okay, so both of them, they're actually closely related. Okay, that's fibrous cortical defect and non-ossifying fibroma. They are closely related. That's why they always discuss them alongside. So they're actually benign stuffs. Okay, they are not malignant stuffs. Okay, so let's talk about them one by one. Okay, maybe at the end you guys will make sense from it. So fibrous cortical defect is actually a benign lesion of fibrous tissue. Okay, so fibrous tissue is actually replacing the normal bone in the cortex. Okay, so where you're supposed to have normal bone, you're having fibrous tissues there. It's found in about 40% of children between ages 4 to 15. So it's usually discovered incidentally on x-rays. So location is usually metaphysis of long bones like the femur and the tibia, the rest of them. Now radiology, you see small, that's less than 3 centimeters, well defined eccentric lytic lesions in the cortex surrounded by a rim of sclerosis. I have the radiographs here. Okay, so can you see? I think this one actually defines it very well. So it's asymptomatic, no treatment is required. It's found normally in children, so it should resolve spontaneously. Now, what is a non-ossifying fibroma? It's a larger version of fibrous cortical defect. Okay, so it's considered the same lesion, but it has a bigger and is actually extending deeper. Okay, it's common in adults and younger adults, adolescents and young adults rather. Occurs in 10% of the population, usually metaphysis of long bones. Okay, so radiography, the lesion is now larger than 3 centimeters. It's eccentric, multi-oculated, lytic lesions with sclerotic margins. So clinical features is usually asymptomatic. Sometimes it might be painful. Treatment you can just observe. Okay, or sometimes if it is so large, bone grafting could actually come in. So that's it for the fibrous cortical defect and the non-ossifying fibroma.